So next up, we have another tech showcase from one of our premium sponsors, Softheon. We will have a presentation on leveraging edge computing to fuel your ACA strategy. We are fortunate enough to have Ferris Taylor from the Healthcare Executive Group, accompanied by Kevin Deutsch of Softheon. Gentlemen, go right ahead.
Great, thank you, John. And I will just share my screen here, then we can go ahead and get started. Give me one moment. All right, should be coming up right now. Can everybody see the screen, John?
Yep.
All right, excellent. Well, thank you to our partners at WEDI, John, Michael, Matt, Charles. It's great to see everybody and really appreciate you always putting on these events, even in the virtual setting. You guys are true professionals at this process and really appreciate it. I'm grateful for the opportunity to be here today with our partner at the Healthcare Executive Group and my good friend, Ferris Taylor, who has been discussing the ACA with us for quite a while. And a lot of our presentation today is going to be focused on some of the challenges and opportunities in the ACA and how we have some thoughts on edge computing and how those technologies may be able to be utilized to improve your ACA strategy. And for those of you that aren't participating in the ACA today, I can assure you that this content will absolutely still apply. So without further ado, we will jump right in.
Thank you, Kevin.
And we'll start today's presentation with a point in time. The date was November 9th of 2016. And I'm sure many of you may recall that day in history. And I think the headline pretty much says where we were on that given day. When President Trump was elected, there was a lot of uncertainty and a lot of questions about the Affordable Care Act. And a large majority of our business at Softheon was focused in the Affordable Care Act. And I vividly remember coming in that morning after staying up into the early hours of the 9th to see the results of the election. And we were sitting around the conference room table trying to figure out, where do we go from here? There was a lot of uncertainty in the ACA, and we were thinking of ways that we can continue to diversify our business and make sure that we could remain relevant with all of the uncertainty. And what we've realized that over the past 5 years, there's actually been policies put in place by the Trump administration that have actually strengthened the ACA. And where we are today is a significantly different position than where we were when we had this conversation back in 2016. So over the course of today's presentation, we'll give you just a brief history of where we've been and where we are today with the ACA, talk about challenges and opportunities, and then of course, take a look at the technological implications of some of these challenges. And as someone who is very familiar with a lot of the ups and downs of the ACA and got involved right from day one, I'm going to pass it over to my partner, Ferris here, to take us through some of that experience. Ferris?
Thank you, Kevin. And just to reiterate, thanks to WEDI and each of you in the session, and especially to Softheon. The fabric's woven very tightly here. HCG partners with Charles and WEDI on a lot of things, and Softheon is a sponsor of both organizations. So it's great to be with you. And Kevin, you mentioned the point in time. This morning, Mickey Tripathi gave us a point in time as well in his opening remarks. It was 12:01 noon on January 6th, when to the right side of this slide, he began his journey with President Biden and what we call Biden Care. The other bookend on that, my personal point in time with respect to the Affordable Care Act, was sitting in a conference room on March 22nd, 2010 at an HCG annual forum. And Sunday night, the night before, the Congress and the Senate had just passed the Obamacare or the Affordable Care Act, our keynote speaker happened to be Mark McClellan, who had been the head of CMS. And naturally, he walked into a room of 100 people that had some very high anxieties about the changes that were taking place. He said, let's take 10 minutes, let's vent, let's get the frustration out, but it's now the law. Let's go to work. And so there are multiple bookends here that we need to talk about. And this slide, I'm not going to go through all of it, but there's been terrific evolution take place under the three administrations. I happened to, a few days later after that HCG conference, have lunch with a friend and a colleague here in Utah. And he said, hey, Ferris, in the Affordable Care Act, there's an opportunity to borrow money to start a health plan. And I remember saying at the time, you're crazy. I still look back on it and say it was crazy. But we did get involved in getting funding to start a co-op here in Utah, Arches Health Plan. It was a challenge. We're in the process of closing that co-op down because of some of the three administration evolutions that have taken place here. And as I said, I won't highlight all of these, but there are many dimensions of each of the administrations with respect to the Affordable Care Act. The co-ops create competition in each of the marketplace to try to drive down prices. From day one, it was kind of a repeal and replace or repeal, and we're still waiting on the replace. Now we've evolved with an administration that's looking at changes in the future that could be even more dramatic for the landscape of healthcare. A lot of political uncertainty, audits and reconciliation, medical loss ratio requirements, a lot of Supreme Court rulings around whether the penalties were a tax or not. And now we're seeing even more enhanced subsidies coming out of that. There was a cliff at 400% of federal poverty level and qualifying for subsidies. Now that cliff is being removed and they're expanded subsidy eligibility. We had a 2.5 month open enrollment period. That was cut to 45 days. Now it looks like, and we'll talk about it more, but open enrollment is an ongoing thing. Right now we're extended into August. Extensive qualifications to get a special enrollment approval. Those got limited, and now we're seeing them be very flexible. I just a few minutes ago saw an email pop up on my computer with a promotion to look at my Affordable Care Act plan. I'm past that, I'm in Medicare, but there's a lot of promotion now that had not existed during President Trump's administration. Medicaid, from the beginning, it was unthought of that all the states wouldn't take advantage of the federal funding to expand Medicaid. That got very restricted, and we're seeing changes there. Bottom line, market instability, a lot of risks, a lot of political things around cutting the risk corridor. Now we're seeing more market stability. Premiums are a little more stable, but in fact, a lot of things are changing. And we need to recognize that as we talk about Obamacare and the cornerstone of the Affordable Care Act, and then this process, political process, repeal and replace, and now reinvigoration of the Affordable Care Act, that we're only 4 or 5 months into the Biden administration, but we've already seen major changes and are anticipating even more. So Kevin, talk us through what are some of the things you noticed and some of the opportunities that exist today as we've gone through a decade of evolution around the Affordable Care Act.
Absolutely, Ferris. And to fast forward to where we are today, and since President Biden had taken office, they continue to be in the headlines related to the Affordable Care Act, starting with some of the executive orders, as Ferris mentioned, extending the special enrollment period originally to May 15th. What followed was the American Rescue Plan Act and the implications to increase subsidies and COBRA. So there's been quite a bit of changes that continue to get introduced over the past few months of the Biden administration. More recently, instead of it being May 15th, the special enrollment period was extended to August 15th. And we're noticing that many of the states are following suit as well, not just the federally facilitated marketplace, but also many of the state-based exchanges as well. And lastly, as of just about a week ago, we had eclipsed 1 million new enrollees into the ACA. So what you're seeing here is really a ton of continued growth, from the increase in the subsidies, as Ferris had mentioned, making it where there's over 1 million new eligible enrollees for a subsidy. And we had just gone over 12 million enrollees for the first time since 2017. So you could see that that downward trend is starting to go up again, and we could see incredible growth over the next few years.
Well, and Kevin, you know, success doesn't come without challenges, and this is great success, but talk us through some of the challenges.
And I think what's important here is that we are now at the point where you're in the second loop of the roller coaster. So we talked about how great everything used to be, then we talked about the uncertainty, and then everything's great again, but is it actually great? There's still plenty of challenges out there. And what we'd like to talk about here are a few of those challenges and the implications that it has on the health plans that are operating in the ACA. Number one is the increased audits and regulatory changes. We are partnering with our health plans right now who are undergoing 2017 audits of their enrollment, their premium billing, and their payment data. So based on the Biden administration coming in, they're doing a lot of cleanup from the past few years. And that leads us to our next point, which is reconciliation. Reconciliation is more critical than ever as a result of some of these subsidy changes. Issuers need to make sure that they're in a place where they can reconcile not only the enrollment data, but also the financial data and those subsidy payments. Because as you're reducing that member responsibility, the subsidy payments are increasing, and that leads for an incredible opportunity and also a challenge if you don't have the right infrastructure in place to support that. And what we're seeing in the Affordable Care Act now is, as the consumers become more educated about their health plan, and we could say that right in the beginning of the ACA, the consumer was not very educated. They were used to the old model. And now that we're really moving into consumerization of healthcare, their expectations continue to grow. And with those higher expectations come higher demands. And with all of this potential growth, we're also seeing new competition get into the market. So there is quite a bit of push and pull here. You have the opportunity with all the potential growth, and then you have to think about, how am I going to be able to scale, and how am I going to be able to meet these demands that are in the marketplace? So this will be our turning point here in the presentation. Now that we've set the stage for where we've been in the ACA, some of the new challenges that have been introduced to the health plans, we're going to talk a little bit about the technology implications. And we had come across this study from McKinsey, which we found really fascinating and completely relevant to what we're seeing here in healthcare. In short, they had come up with 6 unique principles to modernize their next generation platforms. And where we are today in healthcare, as it continues to get more and more complex, is we continue to update these old legacy platforms and never go through that modernization effort. And what we'll talk about here is how we've sort of taken these principles that McKinsey shared through banking and how that may relate to healthcare.
And Kevin, as I read down through those principles, and that banking analogy is a great one, and John and Ryan in the prior session and several have talked about, you know, banking transitioning to healthcare. From your client's experience, what are the of all of this detail, what are the key takeaways and implications for healthcare?
Yeah, and it really boils down to a few things, and all of them will tie back to a reduced turnaround time. So being able to make these changes quickly as they're introduced from the federal government, the state exchanges, or even self-induced, right? And then also a reduction in cost and administrative burden. So when we look at these three principles that we created for healthcare, the first one is integrators, connectors, and adapters, oh my, not to be confused with the lions and tigers and bears that the Wizard of Oz characters had to deal with. But the first principle is really focused on moving processing to the edge and not going through a full rebuild every single time a new requirement is introduced. And in speaking with health plans across the country, we're constantly hearing the same story over and over, that as these changes are introduced, we need to reinvent the wheel and build a whole new process without leveraging some of the pieces that we have in place today. And this concept of using these integrators, connectors, and adapters allows for the health plan to tap into systems that are already established and in place that can plug into any core admin systems. Now, taking that a little bit further, we talk about modularity, and anyone who has heard me speak before, and I know that I've spoken to this group specifically about modularity before, is that this is a cornerstone to everything that's being done to support these multiple lines of business, not just the requirements of the ACA, but if you're a Medicaid plan or you're looking to get into Medicare Advantage, it's critical that you have a core set of modules that can be reused over and over again and configured to meet the needs of that specific line of business. And we'll talk about that in a bit greater detail in just a second. And all of that leads up into the cloud, everything as a service. I'm sure many of you have heard this topic and this phrase before, but ultimately we're continuing to see that progression from the on-prem mainframe applications into software as a service or infrastructure as a service, and all of the as a service subscription models that we're seeing out in the industry today. So these three principles are all interrelated, and they don't need to be implemented all at once. This can be through agile processes, slowly introduced to your organizations to have a tremendous impact as we move forward here. And so as we continue to discuss, this is one specific use case. There's many more that we can talk about here, but to demonstrate what we mean by this concept of integrators, connectors, and adapters, there's a specific use case that we have with our health plan partners today. And this is the concept of connecting to the public exchanges, the private exchanges, and CMS while having one pipe going into the health plan payers system. So when you look at this here, the payer is essentially using Softheon as that adapter, that integrator into these already established components with these federal and state exchanges, as well as the private exchange, to ultimately do all of that processing up front and pass only what's necessary into the payer system. And one quote that we have from a health plan executive that we've spoken to is, they were, by moving these processes further upstream, specifically related to their premium billing and payment processing, they were able to increase their effectuations by 11%. And that story continues to be true because it improves the engagement with the consumer. The further upstream you bring these processes, we talk about edge computing, the more engagement you can have with these consumers and the more easily accessible the system is without making all these drastic downstream changes. We'll transition now in a moment here to talk about the current state of many of these platforms. And the fonts were intentionally created like this to show the level of complexity in these systems. This is just an example. As you can see, the group and the Medicaid have the most processes in this core enrollment platform. And you can see the arrows tying into the core finance platform are all over the place. And this just shows some of the disparities that we have in the systems today that are built, that we continue to make these systems larger and larger and larger that have trouble to connect with finance platforms, which then leads to a poor experience down to the consumer. So I think many of you that are listening to this presentation would agree that we have a very complex, convoluted system that continues to get more and more complex, and we try to force a round peg into a square hole. Now, when we look at what the future state may be, we talk about this concept of different modules and moving the processing further upstream. So in this specific example, you'll see that we have a very small core platform. The core platform is focused around core, enrollment, billing, accounting, and so on and so forth. But all of the processing for those specific lines of business, whether it be marketplace or Medicare Advantage or Medicaid, commercial group, what have you, all of that is moved further upstream, and those modules are then connected into your core platforms. So the model that we're presenting here is to trim down the processing that's happening in your core systems and move that processing further upstream, whether it be homegrown modules that you all would build or whether it's partnering with a technology solution that's already out there. The concept here is that we're trying to simplify that experience and really streamline it and allow it to scale going forward.
And Kevin, simplicity is the ultimate sophistication, but as you've mentioned, and we've heard multiple times over the course of the WEDI conference, healthcare is very complex. Can you tell us or help walk us through as a health plan how you deal with all of the silos and the complexity of healthcare, especially in the Affordable Care Act? Yeah,
Absolutely, Ferris. And this next example, for those of you that have seen the old treasure hunt where you have X marks the spot, or if you're at the mall and you have the sign that says you are here and you have to find where the store is that you're looking to shop at. But essentially, this is that same concept of modules which are strung together to create solutions, blown up to show the entire ACA marketplace end-to-end experience. And when you look at step one, starting in an engagement module, which talks about a shopping experience, and then continuing to flow all the way through down to a data analytics platform, these 18 steps are things that can be strung together to create that marketplace solution. And the basic premise behind all of this is that you'll establish these different modules, and what would change is the services that are underneath each of those different modules. So in this example, we're talking about ACA Marketplace. However, you can vertically scale this process by adding a component that talks about Medicare Advantage shopping as an example. So the whole point of the story is not to make this overly complex, but to simplify it in that you can create these different services that roll up underneath modules that get strung together to ultimately create solutions to support the lines of business that you're currently operating, whether that be marketplace, Medicare, Medicaid, any other product line that you're currently supporting. But it's the general premise that you can reuse different services that you have already in place, and you can extend and add specific processing rules for these other components that you're looking to address. And as we tie everything together here, we talk about this concept of everything as a service. And I think Gartner did a really good job to show the progression from the traditional on-prem model to what we're seeing with the SaaS subscription models today. And this progression will continue to proceed forward over time. And it really gives an opportunity to create a best-in-breed solution in that you don't want to build or acquire a system that has all of this unnecessary functionality in it. The whole point is use only what's critical to your business process. And that could mean multiple partners. It could mean a single partner that just has that specific solution that you're looking for. So as we continue to see this transition and migration further into the cloud, we expect this to continue to occur to allow for increased scalability without requiring additional hardware and additional technology resources to be able to solve those problems, whereby you as the health plan executive can focus on the core business and the true differentiators of your plan against the competition. And we look towards a brighter future as we start to come out of this global pandemic and hope to see everybody in person here soon. But you really look at some of the benefits of using those principles that we just spoke about. First and foremost, and working with health plans for as long as I have now, it's all about the member experience. So by following some of these principles, you have a happier member. By doing that, you also have happier end users internally because there's less administrative burden, there's less operational cost to be able to scale these specific solutions. As I mentioned, the health plan can truly focus on the differentiators and what makes that plan unique. And you could build solutions that will ultimately solve the business problems that are constantly being thrown at us. Because of all the changes with the Affordable Care Act, because of this reinvigoration, as Ferris mentioned, in the Affordable Care Act, there's such a tremendous opportunity, but with that comes significant challenges and a real focus around building solutions that are going to scale. So with that, I know we have a couple of minutes left. I'm going to pass it over to Ferris, and I really appreciate everybody's time. We're just scratching the surface with a lot of this content in the time allotment that we have here, but Ferris is going to share with us a unique opportunity to keep the conversation going with our partners at the Healthcare Executive Group.
And we apologize, we had planned on a few minutes for Q&A, but we forgot to announce that you could put those into chat. But in any case, as Kevin mentioned, in partnership with Softheon and with WEDI, HCG is offering a number of focus area roundtables. They function very similar to the work groups that WEDI has in place right now. The difference is that Kevin and I want to get out of the panelist function. And so we're inviting you to become each of you to become a panelist on further discussion around the challenges and the best use of technology and the way to remain compliant with all of the changes in a real-time way that are taking place in healthcare right now. We've already had a first roundtable on health policy in the ACA. It was a very active participation. We have another one scheduled at the end of the day on Wednesday, May 25th at 5 p.m. If you're interested, you can send an email to info@hcg.org. It's also linked on the HCG website, or there's a short form that you can fill out, which is a bit.ly/HCG focus area workshop, or FAWS, HCG FAWS. And in closing, I just want to thank WEDI, Charles, Michael, Matt, the whole WEDI team for a great conference that's been going on the last few days and continuing. And also to thank Softheon and the other HCG sponsors. Softheon is our focus area partner around health policy and the Affordable Care Act. And we appreciate their active involvement. Have a good day. And John, I think I pass it back to you for the next session.
Yes, and I'm actually going to toss the ball quickly to Michael. So Michael, take it away.
All right, thank you very much. I'll receive it. Kevin, Ferris, as always, thank you very much for being a part of our event and having such a fantastic presentation. We value the relationship we have with both Softheon and HCEG and look forward to many, many, many more years together.
Thank you, Michael. Appreciate it.
Thank you. Have a good day.